I'm Dr. William Berger, and today I would like to talk about the menopause metabolic cliff. When women reach perimenopause and menopause, they often feel like what used to work for them in terms of their lifestyle for controlling weight and so forth no longer works. They used to be able to eat a certain way, exercise a certain way, a certain amount, a certain frequency and intensity, and control their weight. And all of a sudden, they're starting to gain abdominal fat, visceral adipose tissue, and they're not able to control the weight. It just keeps going up. They're having hot flashes, night sweats, they're not sleeping well, and sleep is foundational to your metabolic health too, and it's like a vicious circle. So what I do here in my practice, and I am board certified not just in internal medicine, but also obesity medicine and certified in menopause practice by the Menopause Society, is I take a multi-pronged, multi-angle, holistic kind of approach to women when they enter menopause. If hot flashes, night sweats, insomnia, and so forth are an issue, then hormone replacement therapy is FDA approved for that, as it is also FDA approved to prevent osteoporosis, if that's a concern for the patient. But controlling those vasomotor symptoms, the hot flashes, night sweats, and helping them get better sleep using estradiol and progesterone respectively, that can really make a huge difference in what's going on metabolically. First of all, accumulating fat in the belly, that's typically a male distribution, the so-called apple appearance, as opposed to a pear of the body type. And the reason that women can start having increased abdominal fat at that point in time is that their estrogen levels are falling rapidly. And therefore, all women have testosterone, just not as much as men do. But they have more of a male kind of a hormonal profile in a way, because the estrogen is going away. And that can result in that increasing abdominal adiposity. It also increases cardiovascular disease risk to that level, which is comparable to men of a similar age. Before menopause, women's cardiovascular disease risk is quite a bit lower than men, but they catch up at menopause. And that's also because the estrogen decreases greatly and remains low unless it's supplemented with menopausal hormone replacement therapy. And of course, there are also oral medicines for the vasomotor symptoms, the hot flashes, night sweats, insomnia. Veoza is a great new oral medication for this. There are also the old-fashioned SSRIs, things like Prozac and Zoloft and so on. But also there's just plain old lifestyle, increasing exercise, tuning up the diet and nutrition. And we have an exercise physiologist and a health coach, as well as a nutrition expert for this purpose. So here at Northeast Medical Practice, foundational is lifestyle, all the pillars. And also on top, we use medicines, and that could also be for weight management. I use a variety of different what we call anti-obesity medicines or weight loss drugs. And these range from older oral medications to all of the new injectable wonder drugs that you constantly hear about in the news and on social media. Wonderful tools to help anybody with managing obesity, but in particular, when women go into menopause and start to have this weight gain issue, hormone replacement therapy doesn't really help very much with weight gain, and it's not FDA approved for that. It can maybe halt the progression of abdominal adiposity by giving back the estrogen. However, if we really want to work on weight loss, then I often couple a weight management drug of some kind, whether it be Zepbound, Wegovy, or an oral like Contrave, with any other treatment that we're giving the patient to help control that adiposity and the progression of insulin resistance to prediabetes, God forbid diabetes, the cardiovascular disease risk, the GLP-1 family of medicines decreases. I take a really multi-pronged approach. Lifestyle's foundational. We can think about hormone replacement therapy or some kind of oral medication for vasomotor symptoms of menopause, and also weight management in lifestyle, but also medication. This can really be a great synergistic kind of approach to the metabolic issues that women often begin to experience as they approach that time in their life. So if you'd like to learn more about how we can help you optimize your health, we are Northeast Medical Practice. I am Dr. William Berger, the founder of the practice. We are located in Great Neck, New York on Long Island. You can reach the office at 516-604-3418, online at northeastmedicalpractice.com, through our various social media outlets where you're probably watching this, including our YouTube channel. and also my LongevityMD podcast on Spotify, where I interview physicians and other clinicians who are experts in their fields, and we chat about health optimization topics like this one. So everything we share here, of course, is for educational purposes only, and no doctor-patient relationship has been formed. If you have particular questions or concerns about your health, don't hesitate to reach out to your medical professionals. But until we see each other next time, I wish you good health.